Namaste, good evening. This is Dr. Aparna. I am an Ayurvedic psychotherapist. I am a passionate Ayurveda and psychotherapy infopreneur, an emotional healing synergist, and a medical writer. In my pursuit to address, promote, and propagate Ayurveda and psychotherapy globally, I come up with discussions on different topics regarding Ayurveda, mental health, psychotherapy, and related aspects. I even do book reviews on the same genre. If you have been following, in the previous session, we were discussing about ADHD, that is Attention Deficit Hyperactivity Disorder, in teens. So, we discussed what is ADHD, what are the signs and symptoms of ADHD, and how can, we were discussing about how can parents and teachers in school contribute in, managing a child with ADHD. So, just for people who have missed in the last session, ADHD stands for Attention Deficit Hyperactivity Disorder. So, this is a neurodevelopmental disorder. So, it's a common condition that affects how a person focuses, sits still, and controls their impulses. In simple words, so there could be trouble focusing. So, people with ADHD might find it hard to pay attention in school, at work, or even during conversations. So, they might get easily distracted by sights or sounds around them. Hyperactivity. So, this is more common in children, with ADHD. So, they might have excessive energy and find it difficult to stay still and control their energy for long periods. The next thing is impulsivity. So, this means acting without thinking things through first. So, acting without thinking, this means people with ADHD might blurt things out or make choices without considering the consequences. They don't consider the consequences. So, to elaborate on parents and guardians, we had discussed, I had talked about how parents can play a vital role in supporting their teens or adolescents with ADHD at home. So, they can create a structured and supportive environment, and they can implement effective behavior management strategies. So, how they can collaborate with healthcare professionals, to ensure that their child receives the best possible care. So, how can they be, parents do that? So, creating a supportive home environment. That means structure and routines. So, adolescents with ADHD often thrive on predictability. So, parents can create a structured home environment by consistent schedules. So, establishing consistent routines for meals, consistent routines for homework time, bedtime, and wake up times to start with. So, this provides a sense of order and reduces anxiety for adolescents with ADHD. And organized spaces, that means maintaining designated areas for homework, for chores, and leisure activities. So this could help adolescents to stay organized and to for minimizing the distractions around. So, for example, a girl with ADHD struggles with, mornings. That means her parents, what they do is can establish a morning routine. So, you can set a wake up time, set a breakfast schedule, and designate time for getting dressed and prepare for school. So, this predictability, so this time I'm going to do this, helps the girl manage her mornings with less stress. So, it's the second thing. Second example. So, a boy with ADHD has difficulty finding his homework and school supplies. So, what parents can do? Parents can create a designated homework area with all the necessary supplies readily available. So, what happens? This reduces the time the boy spends searching and allows him to focus on completing his assignments. So the next thing, so to reduce distractions, so minimizing distractions at home can significantly benefit adolescents with ADHD. So how can you do this? By limiting screen time. So screen time is a distraction, so setting clear limits on screen time. So only this much time, only half an hour or an hour you can spend on screen, especially before bed. And this can help adolescents regulate their energy levels and improve focus during homework time. So all their focus would be on screen time, to shifting that screen time focus to homework time focus, or some other purpose, productive purpose. Next is quiet study space. So you have to create a quiet study space with minimal distractions. Example, to keep that study space away from the TVs or video games, or whatever games they can have control of. So this allows your teens to concentrate better on their schoolwork and academics. So, for example, a boy with ADHD struggles to focus on homework if the TV is on. That means his parents are watching TV, and he has a little bit of noise around. So, his parents, what they can do is they can establish a quiet study space in a separate room and agree on designated screen time. So, screen time and screen free time to minimize distractions during homework sessions. Second thing, a girl who's 17 years old finds it hard to resist the urge to check her phone while studying. So she has to always check her phone while studying. She cannot resist that. So her parents can implement a system where that girl keeps her phone in a different room during the designated homework time, so allowing her to focus on her assignments without interruption. So the next thing is behavior management strategies. So parents can contribute in positive reinforcement. So what? Encouraging desired behaviors is crucial for adolescents with ADHD. So how can they do that? Praise and recognition. So acknowledging and praising their child for completing tasks or efforts, their efforts and will to complete task as well. So praising them or appreciating them or recognizing them for staying organized or exhibiting positive behavior. So what happens is, when you acknowledge and praise them, this helps build self esteem and motivates them to continue these behaviors. So the next thing is reward systems. Developing a reward system based on achieving specific goals. That means completing homework on time, managing their chores, or like cleaning their wardrobe or setting their wardrobe or something like that. So provides, what happens is, this act of rewarding provides teens with a sense of accomplishment and motivates them to reach their goals and motivates them to redo it every time. So, for example, a 14-year-old boy struggles with ADHD to finish his homework on time. So, what his parents do is, his parents can implement a reward system where the boy earns privileges like extra video game time for completing his homework on schedule. So this thing encourages him to do it again and again because he is getting an extra video game time. So the next example here is a girl who is 16 years old with ADHD. So she forgets to complete her chores regularly. So What her parents can do is they can create a chore chart with a sticker system on her in her bedroom or her living space. So this so for every chore or she completes, she earns a reward. For example, weekend outing with her friends because she have completed that chore. So upon completing all her chores for the week, so this will encourage her to do it again and again, to repeat this. Next important thing is clear expectations and consistent consequences. So providing clear expectations and enforcing some consistent consequences for are essential for managing behavior. So establishing some rules, there should be some home rules, like discussing and establishing clear and consistent rules regarding chores, regarding homework, regarding screen time, regarding behavior expectations. This helps teens with ADHD understand what is expected of them. So the next thing is fair and consistent consequence. So following through with predetermined consequences for breaking the rules. So how you reward, for an achievement, for an accomplishment. So they should face a fair and consistent consequence, regardless of mood or situation. So if they're getting an extra video game time, if they do not complete that chore or do not complete that homework, that half an hour or 1 hour time they were getting before, that also must to be, taken away. So they should have a fair and consistent consequence. This is not punishment, by the way. This is just taking away their privilege. So for breaking the rules. So this helps them know the importance to adhere to expectations. So for example, a boy who's 15 years old, let's consider him, who's 15 years old, with ADHD, has difficulty managing his impulsivity. So often he loses his temper during arguments. So his parents establish a clear rule about respectful communication and implement a consequence like temporary loss of electronics privileges for outbursts. So this is clear, establishing a clear rule. So, second example, there is a girl who's 14 years old with ADHD, struggles to keep her room clean. So, her parents create a chore chart with established consequences for not completing assigned tasks. So this ensures that girl understand the expectations and the potential repercussions for not meeting them. So for everything, the collaboration is the key. So parents and guardians, do not operate in isolation. So effective support for adolescents with ADHD, they have to communicate with teachers as well. So maintaining open communication with teachers allows parents to share information about strategies used at home and collaborate on a consistent, approach to managing their child's ADHD. So the next thing is therapy and medication management. So working with this depends on severity. If it is less severe, there is no need of medications. Only with the therapists and healthcare professionals, this can be managed. So, to begin with, teachers and schools also play a critical role in supporting adolescents with ADHD. So, by creating a structured and supportive learning environment and implementing specific instructional and behavioral strategies, they can empower these students to thrive academically as well as socially. So how to create, we'll talk about it in detail in the next session, but for just for starting it for there. Also in schools there should be some structures and routines. So adolescents with ADHD, they often struggle with transitions and maintaining focus in unpredictable environments. So schools can create a predictable and structured environment, so they can have consistent schedules, organized classrooms, like that. And they here also there can be reduced distractions like seating arrangements and limited stimuli. Then instructional strategies will I will explain this in detail in the next session. So clear and concise instructions, and to check for understanding. And we'll also know about multisensory learning. And in school as well, there should be some positive reinforcement, so praise and recognition. There should be some reward system in school as well. So we'll discuss all of these in the next session. So post in all your queries, concerns, thoughts, and takeaways in the comment section. Thank you for staying tuned. Namaste for today.